Welcome to the Global Health Round's presentation for SIHA, the Students Invested in Health Association. I'm your presenter Zaid, and today we'll be focusing specifically on the SIHA International team, which works with the local Tanzanian team on various health promotion related projects throughout Tanzania. This is a general outline of what we will be going through today. First, we'll introduce you to our organization, then the team and the five pillars of SIHA. Then we'll chronologically work through the past projects all the way up to our future goals. SIHA, who and where? SIHA is a student-run nonprofit organization that works internationally with various communities and towns in Tanzania. We also have a local counterpart, a local Tanzanian team who helps us with our projects. Where we currently primarily work in the Tungi ward of Morogoro, a small town in Tanzania. As we are in the midst of expanding our WASH program, we will be expanding to different wards near Morogoro. We were previously situated in Montezi before 2018, but moved due to our changing scope and the fact that a lot of our projects were then operating independently of us in Montezi. The SIHA International Travel Team. The SIHA International Travel Team is one of two parts of the SIHA International Team. From the left to the right, we have Kyle, our volunteer coordinator, One, our project manager, Sarah and Rachel, our curriculum coordinators, Janina, our fundraising coordinator, and Anthony, our product manager. SIHA also has two other branches which also help support the international team through means of fundraising. These are local branches. In-country support. SIHA International would not be possible without these individuals, and they are imperative to the functioning of our organization. They are our connection to the community, and they help ensure that our projects are community-driven, provide expertise, manage most of the in-country communication, and make sure our actions fit with the local culture. They are the local counterpart of the SIHA International team. Uh, the in-country support can be broken down into three separate groups. Firstly, we have the in-country representatives, which work on the following. They work on the projects and work on managing the projects and partnerships, village meetings, and food and accommodation for the international travel team. Our current in-country representatives are Milkiori and Charles. The second category we have are community consultants. Community consultants have an invaluable cultural context and perspective. They increase community involvement and buy-in of projects, and they also help teach SIHA members Swahili. Currently, this is Pastone, our community consultant. And the last category we have are in-country volunteers. Currently, we do not have any due to the current situation, and there are currently no projects running on because of that. But yeah, we do have them, and they're invaluable to our experience. The five pillars of SIHA International. Our five pillars are aimed to help us develop our international projects and are founded upon the core SIHA vision and mission statements. Our vision is to empower communities addressing barriers to health. Our mission is to develop the capacity of both SIHA members and the communities we work with to address health barriers by engaging with key local and international stakeholders in the development and implementation of sustainable community-driven health initiatives. The first pillar we will be focusing on is multifaceted action. Multifaceted action. So multifaceted action encompasses two separate categories and two separate approaches in tackling root causes of complex and interconnected health issues. The first of which is a multi-sectoral approach, as can be seen on the image below. The multi-sectoral approach strives to connect sectors such as education, government, healthcare, business, and civil society. It is a communication between different sectors to address the complexity and interconnectedness of health issues. The second approach is the multilateral approach, which incorporates different levels of governance within these sectors. So basically, various agents within one sector will collaborate to find holistic solutions. These principles serve to make sure our project is apt for the intended population and takes into account all possible issues and ideas. Anti-oppressive practices. Anti-oppressive practices are those that involve the recognition and deconstruction of various forms of intentional or unintentional oppression with the goal of equalizing power imbalances. Power imbalances can be prominent and are a likely probability when you're in partnerships. This is something C has been striving towards to maintain sustainability. And it's important to recognize that there will be a power imbalance based on the situations of each organization involved in a partnership. And it's important to recognize those power imbalances and attempt to equalize them. Community driven initiatives. Community driven initiatives are those that prioritize community agency, connecting community members with local resources, contacts, or information necessary to stimulate and or strengthen their own health promotion initiatives. Community driven initiatives are projects in which the community is involved in every step and they feel ownership in addressing their own health issues. This is a key principle as it really helps mitigate any problems we can encounter in our projects due to um, cultural misunderstanding. See guiding principle, the sustainable solutions. Sustainable solutions involve long term thinking and planning, use of local resources, and building community capacity to ensure that projects' results outlast external resources. This is a key problem we encounter in a lot of our past projects, as you will see, as making the project sustainable and occurring even long after even we're gone is a really big issue that we're definitely making sure to consider. And it's one of the reasons that C has been more partnership focused in the later and more current projects. See her guiding principle, knowledge translation strategy. Knowledge translation is a reciprocal of sharing what you know with others in a way that is accessible, relevant, and useful for all parties. This is key in a partnership as it's really important for both parties to be able to understand the different expertise that each organization has and work together towards a common goal. Past projects. So you had a variety of past projects that we undertook, and we'll be going through them in chronological order. There were a few recurring issues with some of these projects, which led to a change in both scope and location to better suit Siha's expertise in 2018. Most of these past projects occurred in or near Mulundizi. The rainwater collection system in 2012. The goals. The goals of the rainwater collection system were to provide an affordable, sustainable, accessible, and safe water resource for the community of Kikongo. The way the rainwater collection system operated was it collected rain runoff from the roofs of houses and moved them to a reservoir of water, which could then be pumped out as needed. And the second goal of the rainwater collection system was to educate individuals on the importance of safe water. There were a few problems, however, with the rainwater collection system. There was insufficient revenue to buy water during the dry season, and the rainwater collection system had several maintenance issues. Results: the rainwater collection system was fully repaired by Siha, and ownership was transferred to the Kikongo Primary School. The biosand filters in 2013. Overview. The biosand filters are a highly effective water treatment system. Siha installed the biosand filters in several places in a small village, someone's house, school, and a public area in 2013 and 2014. The results. The biosand filters in the school and in the house were being widely used. However, the biosand filter in the community areas were not being used. The biosand filters were given to the schools so that the students could use them, and the school stated that the biosand filters were still in use during 2017 when we last checked. Now that we talk about insecticide treated nets, this was one of our most successful projects and it has a, a lot of intricacy to it. Overview. The community members expressed a desire to reduce the incidence of malaria in their communities. So we inquired about insecticide treated nets. Insecticide treated nets are basically nets that cover bedding where one sleeps and basically prevents mosquitoes from biting individuals while they're sleeping, which would in turn help reduce malaria. Initially, Siha purchased insecticide-treated nets, which we will now call ITNs, through their partner to sell at a subsidized price, and these sales continued for several years. In addition, Siha held seminars through their partner organization on malaria health education. There were a few initial challenges, however. Demand for the ITNs was higher than supply because of our limited budget. The distribution process wasn't efficient due to the cultural differences, as the first come, first served process did not work, and the community was dependent on SIHA for insecticide treated nets, which was not sustainable. Evaluation. SIHA analyzed the sustainability of the subsidized insecticide treated nets and determined that the project wasn't sustainable to continue as it was. The results. SIHA established a supply chain in 2016 with key stakeholders that ran dispensaries within two villages. SIHA purchased the initial insecticide treated nets to start the supply chain. The dispensaries within the villages began selling subsidized insecticide treated nets, and SIHA connected the stakeholders who ran the dispensaries to a distributor in Dar es Salaam. As of 2017, there's a running supply chain within two villages that previously didn't have any access to insecticide treated nets. Some of the solutions to these problems also included unsubsidized bed net sale for a general community, fully subsidized bed net distribution to vulnerable low income populations, and lastly, we created the year round supply chain. It's also important to note that it was difficult to ensure the supply chain in different populations. For example, in the Maasai community, which is a nomadic tribe, meaning they move around a lot, it was hard to set up the supply chain, and we instead just gave them an initial supply of insecticide treated nets. They did report that they had no cases of malaria within the first season, after which we gave them insecticide treated nets, which is a great success. Committee, which was run from 2013 to 2016. The overview. SIHA led workshops for members of the community interested in becoming malaria educators. These individuals then formed a group, the MEC, or the Moana Bito Education Committee, interested in addressing health barriers through community education. It began as an informal door-to-door seminar from 2013 to 2015. However, due to the structure of the different buildings and their layout in the community, that being very far and very spread apart, as opposed to the close nature of buildings that we have in certain developed nations. It was really impractical to have these door-to-door sessions. But the MEC themselves actually proposed the solution that they do seminars in schools and have malaria education movie nights to encourage participation. SIHA helped organize the event and paid for the members of the MEC to be educated by a healthcare worker with expertise in malaria. SIHA provided a 2-year stipend to allow MEC to grow as an organization. This stipend was actually used for two different costs. The first was the necessary cost for the materials for all the seminars, the books and pencils, and secondly was the opportunity cost, which was done by all the Moana Bito Education Committee members for holding the seminars. This totaled up to about $170. Um, the challenges. Membership retention. Firstly, it was reduced from originally 12 members to now 3 members. The door-to-door seminars, as mentioned, were not taken seriously by community members and were changed to school seminars. And lastly, the main problem we faced at the end was sustainability of a stipend. There's no plan in place for when provision of the stipend stops. Moana Bito Education Committee successes. For the first success was the formation of a community-based education group. We also had several school seminars which did increase knowledge of malaria, and students completed tests as a form of evaluation, and the teachers reported that they did know more about malaria after their seminars. And also there was 2-year financial sustainability for the MEC as a result of this stipend. Results. SIHA decided to move to Morogoro, and most of the MEC's projects were functioning without the involvement of SIHA. The stipend was no longer being provided, and SIHA proposed a business model to MEC involving selling school supplies to students in the school to help finance the seminars in the future. This would help ensure sustainability. Now we will focus on some common problems associated with some of these past projects. So firstly, the rainwater collection system and the biosand filters. There was a rushed implementation which led to some problems. For example, for the rainwater collection system, there was some maintenance issues, and for the biosand filters, the community biosand filter was just not being used much, possibly due to lack of cultural consultation and it not being prominently used otherwise. Then this for the insecticide-treated nets. There was initially a lack of sustainability, which we then solved. There were some cultural understanding problems just in terms of the distribution system, where the first come, first served did not work. And lastly, of course, the budget, which prevented us from meeting all demands for the insecticide-treated nets. The Moana Bito Education Committee. Well, initially there was a lack of sustainability just due to the stipend, and also, I guess, the door-to-door seminars were impractical due to the lack of cultural understanding, and they were not taken seriously. Now we'll be talking about partnerships, and this kind of relates on to SIHA's later projects and how they're different from our past projects. So the first thing we'll focus on is a project. A project is when one organization will work on a specific thing. So these are just some examples where SIHA will offer seminars to EVO on grant writing. SIHA evaluates EVO's knowledge on grant writing. SIHA chooses the initiative for which EVO writes a grant proposal. And just as context, EVO is a project that we undertook, and we'll be talking about it shortly. This actually leads right into it. And then technically, is partnership. SIHA works with EVO to focus their ideas and fill out the template of a grant proposal. Note that in this case, SIHA and EVO are two separate entities who are working together for a common goal. EVO works with SIHA to develop a project for which we are a primary funder. EVO uses skills they gained in writing in a grant proposal to SIHA to apply for an external grant with SIHA. SIHA also focuses on developing partnerships with local non-governmental organizations that will benefit both us and the local organization. We are working on developing successful partnerships in the Morogoro region right now. We are still new to the region, so this is an ongoing process. The differences between solo projects and partnerships were highlighted in the past diagram, and this focuses on their 3 C's, or the key aspects of these partnerships. One key attribute of these partnerships is that they enable us to make our product sustainable by employing the help of another organization. The sustainability is really the key solution for a lot of our past project problems. So the 3 C's. There are 3 components to a partnership, and the first one being cooperation, where you share general information and there's minimal formal interaction. Then there's coordination, where you discuss ideas, share decision making, and coordinate services to help achieve shared goals. Work together, and lastly, there's collaboration, where you work together at every stage, share resources, risks, and benefits. There are three main questions that you ask in every partnership. Firstly, what do both organizations want from a partnership? Secondly, will projects benefit from a partnership approach? Or will both parties of a partnership experience sufficient return on their investment of resources? And lastly, are our philosophies compatible? What differences can we accept, or what values and beliefs will we not compromise? Power imbalances. So as mentioned before, there will be power balances in partnerships. Each organization benefits from a partnership, but there's an understanding that power will be distributed but not equal. These differences are not necessarily good or bad, but there are facts to acknowledge at the front end so they can be appropriately dealt with. The sooner they are openly recognized, the sooner steps can be taken to ensure that they do not negatively impact the partnership. And power imbalances are inherent. They are existing in something as a permanent, essential, or characteristic attribute. They are not going away, so accept them. Uh, yeah, power imbalances may exist based on the different skills, resources, and expertise each party has going into a partnership. Evaluation of a partnership. There is 2 types of evaluation. Firstly, the process evaluation, which is the fidelity of program implementation. Are all the project activities going to plan? Are they targeting the appropriate people? For example, how many maternal health seminars has this community delivered in the past few months? And the outcome evaluation, short and long-term changes. What progress has been made towards achieving the goal? Has there been a noticeable change in maternal health practices following the seminars? So, as the name suggests, the process evaluation will focus on the process itself and how you can change that. And outcome evaluation will focus on what the project is achieving. SIHA scope. So this is a nice image just depicting what's inside CHA's scope and what's outside CHA's scope. It's important to note that when we're making these partnerships with these NGOs, these non-government organizations, and other organizations as well, we have to consider if it's within our scope to undertake a certain project together with them, or if it's beyond our scope. And it's important to recognize what we're able to do as CHA. This is the last past project slash partnership we will talk about, and it's the Endlesa Vagina organization, or otherwise known as EVO. So this was established in 2013 as one of CHA's projects. CHA provided a group of community members seminars aimed to increase capacity in achieving organization goals, called capacity building. This group became EVO, and EVO expressed an interest in becoming a separate organization, thus leading to a temporary partnership. EVO aims to support youth by providing education on health-related issues and life skills. They initiated two different activities. Firstly, a soccer club to encourage activity, and a World AIDS Day, which is a once a year event to educate individuals about HIV and AIDS to decrease stigma. So, project to partnership. They changed from CHA working on EVO to CHA working alongside EVO, a cooperative relationship. CHA provided seminars on grant writing and provided EVO with the grant to help start one of their projects relating to increasing male involvement in HIV or AIDS testing. It's important to note that this transfer from project to partnership is uh, is much more sustainable. So CHA does not have to individually manage every single aspect of the originally project, now partnership. Now it's a lot more independent and sustainable. Yeah, it can be seen that a large problem of the previous projects arise due to a lack of sustainability, and by giving the EVO some autonomy and sustainability, the other by helping them learn how to grant write, the other key problem as well, the financial issue was solved. Okay. EVO successes. EVO, as mentioned, successfully transitioned into a partner of CHA from project. CHA was able to give EVO a grant to assist their desire of increasing male involvement in HIV and AIDS testing in their community, and EVO's growth as an organization. CHA worked with EVO to build their organizational capacity and provided support and training. EVO challenges. EVO has voiced that their main challenges are still financial. They also have a lack of time and experience in providing resources for CHA. CHA's division to move to Morogoro meant we had to close partnerships with EVO, which is previously situated in Melandizi. CHA members don't always have the expertise necessary to provide workshops for EVO. Also, lastly, all members of EVO had other full-time jobs, and it made it difficult with CHA to meet with all members at the same time. Why was EVO closed? CHA decided to move to a new region, Morogoro, which means that we cannot help out directly. EVO primarily just required financial assistance from CHA, and CHA provided them seminars on grant writing and a grant. EVO is their own entity, and CHA has no joint projects with them. EVO successfully raised more internal funds. How was EVO closed? The grant that was promised to EVO was delivered. They were informed of CHA's decision to move to Morogoro, and they have our contact information if they need to get in contact with us in the future. Transitioning to Morogoro. This decision was within CHA's best interest because the communities within Melandizi did not always understand CHA's recent change of direction, because their past experience working with CHA was based on financial resources alone. By moving to another community and focusing on collaborating with local nonprofits, the hope is that communities will ideally see beyond CHA's financial capacity, helping CHA drive towards more community-driven and sustainable projects. Groundwork was initially conducted in Morogoro to determine its needs for CHA's projects and expertise. So this resulted in the following: closing down partnerships with EVO and the Monabito Education Committee, MEC, closing down the BedNet project or the Insecticide Treated Net project, holding various meetings with other NGOs in Morogoro for potential partnerships, gathering information for possible partnerships with schools situated in Morogoro, and strategic planning sessions that intended to strengthen the structure of CHA. Now we focus on one of our biggest projects to date, and it's the WASH project, the Water Sanitation and Hygiene project. So the overview, the health director of the Tongi ward identified unsafe water consumption as a problem in the area, causing diarrheal diseases such as cholera and typhoid. The WASH project aims to provide grade 5 students in Tongi Primary School education about water, sanitation, and hygiene. WASH programs have been successfully conducted by multiple organizations in the past. SIHA got in touch with an organization that provides WASH education seminars to students and was able to use their well-made curriculum. It was developed to counteract the effects of common unclean water on the health of residents. These may result in cholera or typhoid outbreaks. Um, just for some context, Tongi is a ward in the Morogoro Municipal Council in the Morogoro District. The ward has two main sources of water, the local spring and the water provided by the government, which is mainly used by those who live far from the spring and can afford it. The water from both these sources is often contaminated for various reasons. This makes it extremely important for it to be cleaned before consumption. Uh, the international team believes that one of the ways that might might prove effective in mitigating the spread of these diseases and promoting consumption of clean drinking water is through the education of water and WASH. Um, it, WASH programs have been conducted by multiple organizations, as I mentioned. The organization that we reached out to was SON International, and we used their curriculum. And we may also set up another biosand filter with SON's help at the Tongi Primary School. Current progress. So we successfully completed the WASH curriculum for grade 5 students at the Tongi Primary School. Our Tanzanian team, many of whom have degrees in education, complete the WASH sessions. We set up a WASH club to ensure the translation of knowledge, and the students themselves will form the WASH club to give it some autonomy. We partially funded a water tank for the Tongi Primary School. The Tongi Primary School had no access to clean water and wasn't able to transform their knowledge from the WASH program into active practice. The student and school contributed a small stipend, and we created a memorandum of understanding outlining who is responsible for the maintenance of the water tank to ensure its long-term stability. We're in the process of expanding this program to more schools. WASH project and their stakeholders. So up until this is a really important part of the WASH project. The stakeholders are pivotal in basically making sure that the project is going along the right path, and they're providing a lot of cultural expertise on the project. The stakeholder is defined as any individual uh, or group that contributes to or is affected by your project. So it doesn't only have to be contributors, but also it could be the general community that lives in Morogoro. So these stakeholders allow us to take into account a variety of perspectives from the community, so we can focus on community-driven initiatives. So the first are the municipal officials of Morogoro, which granted approval to work in Morogoro. The Tongi Ward Education Coordinator, which granted approval to work in Tongi schools. The SON International, which shared their WASH expertise and curriculum, and the Tongi Health Coordinator, which shared knowledge about Tongi's community health status. Stakeholders continued. So next we have the URDI team. They are basically the local counterpart to SIHA's international team. They coordinate meetings with these stakeholders, which are translated and led, and they also translate and lead many meetings. They arrange transfer for both SIHA and URDI members to and from meetings. They share cultural insights to ensure the project is culturally appropriate. They they translate the curriculum from English to Swahili and are responsible for teaching the WASH curriculum itself. The stakeholders continued. So we also have the Tongi teachers, which are slated to be consulted to discuss the project and curriculum. They coordinate the implementation of the WASH program, and they are also to be involved in the continuous evaluation of the WASH program. And lastly, we have the Tongi students, who are the primary recipients of the WASH program, and they're vital for feedback, evaluation, and they're the intended torchbearers for spreading their WASH knowledge. What we mean by that is that by educating these students, they could translate this knowledge further to their peers and their future children, thus making a long-term sustainable curriculum. So, WASH, multifaceted action. So, as mentioned before, multifaceted action is one of the five pillars of SIHA, and it's really important. This diagram basically outlines how the WASH program fits into the multifaceted action diagram. Remember that multi-sectoral would be labeled left to right on the bottom between different sectors, and multilateral would be focused from the bottom to the top based on different levels within an organization. So we have the education sector, we have the civil or social groups like SON, we have civil social groups like SIHA, we have nonetheless, we have the government sector. There are also business and the healthcare sector, but and they are included, but we haven't given them specific names. Current projects, WASH continued. The IRDI and SIHA aim to have the fifth graders make certain connections from education materials presented in the WASH program and disease. By learning these ideas, these fifth graders will eventually be able to spread their knowledge throughout the community and future generations. The problems with this new project are a lot different than the ones stated in the past project, which is important to note. Sustainability isn't a long term, isn't a big issue here. One of the biggest issues we have is effectiveness cannot be determined due to the long term nature of this project, and the project is still awaiting some implementation. The last slide for today is just the future goals of SIHA. The first goal that we have is to expand WASH. The Tanzanian team is creating an implementation plan, and we are planning to expand to more schools. We also want more community engagement initiatives, potential to begin tree planting initiatives at schools and have students take care of the trees after planting. The community has also demonstrated an interest in this initiative, and the government will advise which schools to go to, and the schools will be consulted beforehand. We also want to develop partnerships in the Morogoro region. We have had several meetings with Save the Children, and they are interested in partnering with us to create a combined WASH and nutrition program. It's really important to partner with these different NGOs to gain their knowledge and their expertise in any specific project we be undergoing and to ensure long-term sustainability. So that concludes the presentation on the SIHA International team and what they do in Tanzania. If you have any questions, please don't hesitate to reach out to me at mtahir, M-T-A-H-I-R, at ualberta.ca, and I'll be happy to answer all your questions. Yeah, thank you so much for listening, and I hope it's been a good presentation.